How can we detect if we have a child with scoliosis or spinal curvature? Simply, there is a small test you call the forward bending test, which is the forward bending position. In this position, we observe the shoulder blade. Is one shoulder blade higher than the other or not? If we find that one blade is longer or higher than the other, then there is a curvature in the spine. Peace be upon you. Today, I want to talk to you about something that we might encounter at any age. That is scoliosis, or its scientific name, scoliosis, which is the lateral curvature. I get a lot of questions about what the problem with scoliosis is when we might see it, and whether it occurs more in boys or girls, and what are the symptoms of scoliosis, and what are the problems that result from scoliosis, and what are the treatment methods, and when does it require surgical intervention, and when does it not, and does scoliosis or curvature of the spine get worse or not, and is it hereditary or not? These are all questions that go through the mind of anyone who has this problem with their spine. Today, God willing, we will talk in detail about spinal curvature or scoliosis. To start with, scoliosis can occur at any age. That means it can be found in a child as early as 1 year old when we discover that they have scoliosis. It occurs in girls more than boys. So, doctor, does it have a genetic factor? Yes, it does have a genetic factor. Congenital scoliosis can have a hereditary factor, even within the extended family. That means it doesn't have to be the father or the mother. No, it could be the uncle, grandfather, or another relative who has this curvature or scoliosis. And the child is born with scoliosis, or what we call congenital scoliosis. So doctor, can this congenital type get worse? Yes, it can get worse, or it might not. So when can we know or determine that? Normally, if we have scoliosis and we discover it, so how do we discover that our child has scoliosis or a spinal curvature? Simply, there's a small test called the forward bending test, where the child bends forward and we observe the shoulder blade. Is one shoulder blade higher than the other or not? So doctor, if we find that one shoulder blade is longer or higher than the other, that means there is a curvature in the spine. Alright, so if we find a curvature in the spine, can we tell whether it's getting worse or not, or what exactly is the problem? Will it eventually require surgical intervention or not? That depends on us measuring the angle of the curvature accurately, so that we can identify a precise line under the image. If we measure the angle of the curvature and find that it ranges from 10 to 25 degrees, from 10 to 25, it only requires monitoring, meaning that we follow up with an X-ray every 6 months. He might do strengthening exercises with physical therapy. We might give him some advice about sitting posture, and he shouldn't carry heavy loads. This is monitoring and conservative treatment. Now, if the angle is from 25 up to 40 degrees, no, in this case, a corrective brace for the spine is needed because we're concerned that at this stage, the curvature might worsen and we might have to resort to surgery. Also, there's still follow-up with physical therapy and conservative treatment and the X-ray monitoring every 6 months. We measure the angle and see whether the curvature is increasing rapidly or not. The amount of increase corresponds to the nature of the conservative treatment we're following, whether the patient is actually wearing the brace or not. So, doctor, what if we find that the angle is increasing rapidly and it goes above 40 degrees? Usually, unpleasant symptoms start to appear for this patient, such as difficulty or breathing. They also begin to experience chronic shoulder pain. They might develop chronic lower back pain, and we may be forced to urgently intervene with spinal surgery. So, if we find that the angle is above 40 degrees, we usually have to proceed with urgent spinal intervention. Doctor, is it possible for the curvature not to increase at all? Yes, it's completely possible for it not to increase at all. We can say that in about 50% of cases, it doesn't get worse, and in the other 50%, it does progress, and sometimes quickly. So we have to perform surgery. So if we're talking about this now, how can I be sure that the curvature isn't getting worse? Or how can I know if the situation is dangerous? Well, look, if the issue starts to affect breathing or causes chronic pain and the curvature is increasing rapidly, then in most cases the patient will need surgical Bush intervention. But if during follow-up we find that the issue is mild and not progressing quickly, then it only requires monitoring and conservative treatment. There's nothing more to it than that. God willing, I will talk to you in detail about other conditions like spinal disc herniation or congenital spinal deformities in other episodes. Stay tuned with us, God willing, for more. And may there always be healing for everyone, God willing. Wishing you good health, peace be upon you.